Hi, I'm Dan Depew, the Chief Communications Officer with Middletown Medical, and we are delighted to have with us today for one of our Facebook educational videos, Michelle Appelbaum, who's a family nurse practitioner. She's also a doctor in nursing, and Michelle is a specialist in pediatric neurology. So, Michelle, how long have you been in this field here?
20 years.
20 years. And has been with Middletown Medical for almost a year now.
Yeah, a little over a year.
It's been a tough year to join any medical practice with what everyone's been going through with the pandemic. But I only hear good things.
Well, thank you.
And your patients love you, so that's always good. COVID-19 has changed not just medicine, but it's also changed education. We've seen, parents who could push their kids off to school and let a teacher deal with it now have to take a little bit more and shoulder a little bit more of that educational burden. You and I have talked many times in the past regarding different cases. What have you seen from parents coming in? What type of frustrations have they been dealing with some of their children?
Well, parents are used to having the children do their work in school. Suddenly, when they're home, they see that the child has trouble paying attention. But more so than you would expect for a child that age.
Right.
Also, sometimes homework can take a long time. I mean, homework does take a while, but it shouldn't be lasting into the night.
So a lot of what you do is, obviously we talked about work with pediatrics, but the children that you're evaluating and working with are between the ages of 4 and 18, but you could see folks up until they're 21, right?
Yes.
Okay, and some of the different things that you diagnose and help people work with range from anywhere from learning disabilities, which could also have involvement with ADHD,
yes.
Autism, various levels of the spectrum, and the impact on learning capabilities and life struggles which can come from autism. Tell me, is it all about medicine? I remember when I was a little bit younger and in school, it just seemed that anyone who had a neurological issue, it was, we're going to prescribe them medicine right away. And I think maybe that was a little bit of a pattern then. Is that still the pattern now? What's changed?
It's not all about medicine. Medicine can help. However, medicine alone doesn't help. You need behavioral supports, educational supports, and that then you would determine if medicine would be warranted.
So your role can sometimes be being an advocate, right?
Yes.
To help parents get their children the resources they need in schools. In New York State, we have a pretty robust educational system which defends and looks after children with disabilities. But you have to have a proper diagnosis for these things to apply.
Yes.
What's the process for that to happen? So if I had a son or daughter at home, or I was a grandparent who was taking care of a child, and I suspected some of the things you talked about trouble with homework, trouble with focusing for long periods of time, or even short periods of time, what steps would I take to get to you, Doc?
You would come in, you don't need a referral. You would come in, make an appointment, and talk about the fact that you're concerned about focusing. Once you come in, we do a thorough evaluation, both by history and physical, and talking to the child and the parent, and then determining what's needed.
Outstanding. And certain paperwork that needs to be filled out, you would be able to help with that or make sure that paperwork is successfully filled out for those students?
Yes.
And some of the students who end up with prescriptions, I know the way things are with school, you can't bring pills to school, you can't, bring certain medicines to school unless you have a prescription, and then you work with a nurse. Do you work with a lot of school nurses from time to time? How does that process work?
Yes. First of all, most of the medication can be given early in the morning for ADHD. So it would not have to be done by the school nurse. But yes, the school nurses call and they give papers with all the side effects. We give them papers with the side effects so that they know what to do. And I know many of the school nurses.
I'm saying, well, she knows most of the school nurses, not just because she's been practicing here for some time, but also because she's been a resident of this area for her life, from Sullivan County and now here working in Orange, and also working with Dr. Pampana, who a lot of people love as a pediatric neurological doctor and does a great job. Any words of wisdom as we go through this time? I mean, you're probably seeing all kinds of different things. What are you seeing the most of right now, and if there's something you wanted to share?
I think that for parents who are talking to me about homeschooling, the big thing is to be organized. You want to have everything organized and that the child wakes up at a decent time and you have all of their equipment together. However, you don't want to be too over-organized. You want to make it a little bit fun too.
Right. How do you feel about, sometimes families have a difficult time with space, and I know one of the no-nos is allowing a child to do video learning from their bed or things like that, where they're not really separating, work time from relaxation time. Do you have any advice on that?
Well, the American Academy of Pediatrics says to really only be on screen for 2 hours. Of course, when you're in school, that makes it more than that. If you're in your bed and you're looking at the screen, it does something to the melatonin in your brain. Now, as we all know, we use melatonin frequently for sleeping, so the bed is not the place.
Not the place to
Not
be.
the place to
Well, I guess I'll have to bring that message home. Well, listen, I think it's wonderful that you've taken some time to be here today. If you're looking to have some help or an evaluation for your child, we have great neurologists here. Michelle Appelbaum and Dr. Pampana stand by at the ready for children, and their specialty is pediatrics. They operate currently out of 75 Maltese Drive, which is right here at the Middletown Medical Campus. And to schedule an appointment, there's a lot of different ways that you can do that. You can go to our website at www.middletownmedical.com, and there's a chat feature there where you can chat with someone. You can certainly call our call center at 845-342-4774 and ask to see Michelle Appelbaum or Dr. Pampana. They'd love to hear from you.